Thank you very much, Lorraine, and thank you, Nancy. Now for our final speaker this afternoon, I'd like to introduce Dr. Emma Fulu. Emma is the founder and director of the Equality Institute, which works to advance all forms of equality and prevent violence against women through scientific research, innovation, and creative communications. Previously, Emma was based in South Africa as technical lead of the UK Department for International Development's £25 million global programme, What Works to Prevent Violence Against Women and Girls. She previously led the groundbreaking United Nations multi-country study on men and violence in Asia and the Pacific. Emma presents and publishes widely on the issue of violence against women. She is the author of the book Domestic Violence in Asia, Globalization, Gender and Islam in the Maldives, and blogs for the Huffington Post UK. Please welcome Emma.
Thank you. Thanks. Does this work if I wander? Yes, good. They gave me this because I have a tendency to drift as I speak away from the microphone. So yeah, please excuse me. But I've got this pointer because I think that there'll be things I want to point out to you. So I've been tasked with trying to talk about how do we measure all of this complexity that everyone has raised. And so I'm going to try and tackle that question as we go. I think it's kind of been raised already how this issue of violence against women has finally kind of reached the international agenda, and it's kind of on the global stage in a way that for many of us who've been working on this issue for many, many years, it's sort of a great moment where we feel like we've finally got some sort of traction. And as has been mentioned, now violence against women is specifically included in the Sustainable Development Goals, which is very important, and there's definitely an increasing interest and attention on primary prevention. And I think it's been mentioned that the issue of violence against women, there's this one goal on gender equality, goal number 5, but actually many of the other goals in the Sustainable Development Agenda cannot be achieved unless we prevent violence against women, and that's all the way from goals around poverty to education, sustainable cities and communities, because all of those things, violence against women impacts on all of those areas, which other people have already raised, so I won't go into too much detail on that. The flip side of that is, of course, that if we do manage to reduce rates of violence against women, it's going to have multiple benefits, not just on women's own experiences of violence, but all these other areas around, health, education, poverty and safety as well. So that sort of gives us the incentive, I think, hopefully, to really focus on this issue that has profound implications for so many areas. So the Sustainable Development Goal number 5 specifically now has a target on the elimination of all forms of violence against women and girls in public and private spheres, including trafficking and sexual and other types of exploitation. That's the specific target. Now, the Sustainable Development Goals then have individual indicators that governments are supposed to report against to help sort of track their progress towards achieving those particular targets. So the indicator for this target, 5.2, is the proportion of ever partnered women and girls aged 15 years and older subjected to physical, sexual, or psychological violence by a current or former intimate partner in the last 12 months by form and age group. And then there's also an indicator on non-partner sexual violence prevalence. Now, that's kind of the end goal, right? I mean, and it's a very long-term goal to try and get to reductions in actual prevalence of intimate partner violence or non-partner sexual violence. So this is the slide that Claudia actually showed of mine, which we're talking about. I think everyone has mentioned that this issue of violence is unbelievably complex. There's so many factors that are contributing to violence against women, obviously with gender inequality being at the root, but that across all levels of society, there's various other things going on. So how do we get to this end point of reducing prevalence of violence against women when this phenomenon is so complex? How do we know we're kind of on the right path? or that what we're doing is working, especially when we know that it's going to take years, decades, generations to really get to the elimination of violence against women. I think there's 3 kind of key areas of research that need to be done as we continue to work on this issue. The first is research to understand the complex and changing nature of violence against women. And that's a lot of what Claudia has been talking about, and that is really in Change the Story, which understanding the drivers and reinforcing factors, the prevalence rates of violence. But we can't stop there because it's changing. The nature of violence is often changing. New types of violence are emerging with globalization. New drivers of violence, I think, are also emerging. So that needs to continue. Then we need to look at monitoring and evaluating the prevention programs that we're implementing to see if they're working, to optimize them, to think about how we can replicate them, how we can scale them up, and all of those things. And then we need to think about measuring population level change. So are we on the right track? Are we seeing decreases in prevalence? But before that, are we seeing any shifts in indicators along the way that we might think might say that we are on the right track? So I'm going to talk about the last 2 that I mentioned, not so much the first one today. So the first area is around evaluation of prevention programs. And it's a relatively new field. We did a big kind of global evidence review around what works to prevent violence against women and girls, particularly in low and middle income countries. And many of the things have already been raised. They need to be long-term, they need to address the root causes of violence, they need to be gender transformative, they need to have a multi-sectoral approach or have multiple elements, they need to be holistic in addressing the sort of multiple elements and addressing intersectionality and all of those things that have already been mentioned. And Nancy gave a lot of great examples of programs that actually have been shown to be effective. So I won't go into that in too much detail, except to say that we don't have all the answers yet. This is a new field and we need to keep innovating, and that's why we need to keep evaluating and testing new models of prevention. So how do we evaluate prevention programs? Again, I feel like I'm always saying we don't have all the answers, but what we do know is that there is no one-size-fits-all model of evaluation. But that evaluation is really, really important at this point in time because we need to continue to build the evidence if we're going to move forward. And the key to good evaluation in the prevention space, I think, is that it's fit for purpose. So it means that you really need to understand what your program is trying to change, how it's trying to achieve that change, and what exactly you're trying to measure. And so there's no one single method of evaluation that is, the silver bullet or the best or the gold standard. There's sort of been an increasing attention on the RCT or randomized control trial model of evaluation in the violence prevention space, and that is certainly an important type of evaluation, but it's not the only type of evaluation, and it's certainly not relevant for all sort of programs, and it's not relevant at all stages of the work. So we can think of lots of different models of evaluation, and they can all contribute and be rigorous if they're done well. So strong evaluations tend to use multiple data collection methods, so both quantitative and qualitative, and that they're really appropriate to the questions that they're trying to answer. With this push, I think for one of the things I started thinking about with this push for the kind of RCT model is to try and step back a bit and say, actually, when is a program ready for what type of evaluation? And I think that depends part on how long the strategy or interventional program has been running for. How is it optimized? How well established is it? And it also depends on how much research has already been done on that intervention to prove whether it has some promising impact. So if you're right at the beginning and you're just starting your program, really you're looking at sort of formative types of research that are going to help you improve the program and optimize it before you start thinking about anything much grander. and that might include then you moving into sort of process evaluations or measuring activities and outputs, and that's feeding back into the kind of improvement of your programming. And then as you kind of advance, you've been going for longer and you've got more research to kind of show it's promising, then you might be looking at impact evaluations and thinking about short and medium and long-term impacts. And only sort of when you're really kind of well established, I think, would you be looking at trying to measure, is this program contributing to a decrease in rates of violence, for example? Like SASA, for example, measured recently in an RCT, the Uganda example. SASA had been running for a very long time and had been, had been very well established before it got to that point of doing an RCT. So I think we need to think about the timing of the types of evaluations that we're doing. Overall, I think there's some general principles that apply to all evaluations, and that's that they really should align. If we're thinking about primary prevention from a feminist perspective and being gender transformative, ideally your evaluations should also follow those sorts of principles and be looking at addressing the root causes of violence or measuring those causes of violence. It's really important to think about evaluation from the beginning, but what types of evaluations suit where you're at. Think about what's driving change and how you're going to actually try and measure that, what is actually causing the change. Thinking about how the findings can be really practical for stakeholders, building in learning, so it's not just sort of you're coming in to do research and then leaving, but that there's some capacity building of practitioners and people doing the work on the ground. Sort of more partnership building between researchers and practitioners, I think, is really important. And that it's really based on the principles of gender transformative practice, which has already been talked about. Okay, measuring population level change. How much time do I have? I'm good. This gets really complicated, so bear with me. Okay, so then we think, okay, theoretically, if you implement all these prevention programs across multiple settings at the same time, theoretically, we will see a sort of long-lasting reduction in the prevalence of violence across a whole population. That's kind of what we're aiming for. That's what Change the Story is about, and that's kind of what we all want. And there has been some country examples, actually, where we've started to see shifts. I don't know if anyone, Claudia, did you see the Nicaragua? Mary Ellsberg's. There's a prevalence study in Nicaragua has just been repeated. It's not published yet, but it is that we are seeing actual major shifts in population prevalence across 20 years, which is very promising. But so how do we measure something at the population level that is this complex? Okay, you're not going to be able to necessarily read all of this, but with our watch, we started thinking about, okay, what would change look like when we're thinking about violence prevention? It's not going to be a linear process, but how might we expect things to change over time? And so, and what do we need to do to get there? So this blue line is about what our watch calls prevention infrastructure, innovation and systematization. So building the building blocks that you need in place for prevention programming to work, an expert workforce coordination, et cetera, et cetera. So that's kind of the first thing. You need to strengthen the prevention infrastructure over the short to medium term, okay? And then you're starting to do prevention programming here. And this is improvements in gender equality and reinforcing factors. So as the prevention infrastructure improves and you're doing programming, hopefully you see an improvement in gender equality over time, right? We see prevalence up here, 12-month prevalence and lifetime prevalence, not changing. In the short term, it's not changing. It's going to stay static, we expect. However, as you start to see gender equality improve, what you're going to see is probably an increase in demand for response services in the short and medium term, because awareness increases and the conditions for violence against women decrease, and you've got an improvement in the infrastructure. So you're going to see an increase in demand for response services. Hopefully then, sort of in the medium term, we see that gender equality has gone up, the reinforcing factors have gone down, and then we might start to see a shift in the 12-month prevalence of violence, starting to see here. We don't expect that demand for response services will ever meet actual prevalence, because not all experiences of violence against women will require formal services, okay? And then over time, we've got, the investment can plateau, and finally, we hope to see a decrease in the lifetime prevalence of violence, but that's generational. So this is kind of like, this was a process we did to try and think about how change might happen over time, to be able to think about what we would measure when, if we're trying to track that change. So, if then you are trying to create a holistic model of measurement around population level change, what would you be looking at? So we concluded that, and this is like an experiment. No one has done this. So I'm not saying this is the answer, but this is our kind of working theory. So first of all, you'd want to measure in the short term, what do we need to do to support the change in the short term? And we would want to measure these elements of what we're calling a strong prevention infrastructure. So mechanisms for coordination and quality assurance, an expert workforce, political leadership, et cetera, et cetera. And you'd want to measure, this is kind of like the process stuff, the implementation and evaluation of prevention programs, right? So this is one area we need to measure. Then in the medium term, we need to think about what are the little indicators we can see that we're on the right path, and we think that is changing the drivers, right? So we'd want to see, we're expecting, if you change the drivers, this is the theory, if you change the drivers, you improve gender equality, ultimately that's going to lead to decrease in prevalence. So we should, in the medium term, then be measuring changes in the drivers and what our watch calls as the reinforcing factors of violence. So that's the medium term. Then the long-term outcome is that you'll see we would want to measure prevalence of intimate partner violence, prevalence of sexual assault, both lifetime and 12-month prevalence. And that is the ultimate goal of Australian women and children live free from violence. That's the ultimate kind of goal. So we then did this sort of global review of all the indicators out there that we could find in the world ever, and we turned it into this big Excel sheet, which I think was named the Excel spreadsheet of death by your staff, because it was just this mammoth thing. Anyway, and then we tried to narrow down, okay, what are the ones that really align most with the evidence of what's driving violence? And I'll just give a few examples. I'm not going to go through what we concluded in all of the indicators that we concluded in the end, because then we also looked at what sort of data exists in Australia, what's most feasible to measure here, etc. But these are just some examples of the things you could measure. So in the short term, when we're looking at, say, trying to measure prevention infrastructure, and this data does not exist basically at this point, and it's very, this is something we really need to work on. But we'd be looking at trying to measure things like the existence of coordination and collaboration mechanisms at national and state levels, the number of cross-sector partnerships, so like, linkages between, the alcohol sector and gender work, engagement with different agencies and organisations than those for early intervention and response, the number of prevention programs that are funded and long-term, etc. So there are some sort of process measures that you could look at. For example, in an expert workforce, we might look at the number of health workers, coaches, teachers, etc., who have undertaken accredited PVOR training. That means we need some accreditation, which doesn't exist yet. But these are ideas. Then in the medium term, so we looked at, so for example, by each driver, so condoning of violence against women is one of the drivers identified as contributing to violence against women. For that driver, what are some indicators at the national level that we could measure to say, okay, we're seeing a shift in this? And these are measures that would be collected primarily through population-based surveys, like the public, what is it, the PPS in Australia and NCAS and others. So it might be, for example, this is the ones that we came up with as most aligned to what we were looking to change. Community attitudes towards violence against women that justify, excuse, trivialise, minimise, shift blame, etc. And we have that sort of data from the NCAS survey. Communities or self-reported willingness to intervene, proportion of victims of violence against women who disclosed their experience to someone, number of calls or online requests received by violence against women help hotlines. We'd expect that to go up initially. Number of police call-outs to IPV and family violence incidents, again, short-term, that would go up. Proportion of intimate partner and sexual violence incidents reported to the police, and police prosecution rates as a proportion of police reports. So these are examples of indicators that we could track over time that we argue would suggest that condoning of violence against women is going down. And then the report that we did with Our Watch then looked at the actual existence of the data in Australia and how it relates to structures, norms and practices, et cetera, et cetera. I won't go into detail. This is an example of one of the reinforcing factors, so experience of and exposure to violence other than violence against women. These are some of the things we could potentially measure. Percentage of children who have witnessed intimate partner violence, proportion of children who experience any physical punishment or psychological aggression by caregivers in the past month, percentage of men who report having experienced violence by a male perpetrator in the past months. These are some indicators. I might stop. Okay, these are some indicators that do exist. And so the last one is obviously prevalence rates of violence against women, which is measured internationally and is measured in lots of different ways. And that is aligned with the SDG goal, which is the very end point, right? So that was where we would end up finally. I think I might be. Very quickly, gaps and challenges. Basically, well, there's lots of missing data. Psychological violence in particular, there's inconsistencies around data collection internationally around that. There's a huge need to improve and reduce the gap in data from various subpopulations in Australia, but internationally, women with disabilities, migrant women, Aboriginal and Torres Strait Islander women here in Australia and others. So that's a big area of lack. And there's some drivers and risk factors where there's virtually no data and we couldn't find any indicators anywhere. And those ones, just to be aware, is male peer relations that emphasize aggression and disrespect towards women, backlash, and the context of alcohol use and how it's gendered, and then a lot around intersectionality and social norms is still kind of an emerging field. So they're the kind of big gaps. I think I'm done. Oh, just to say at the very end, we need to be evidence-based and evidence-building. We need to continue to innovate, and we are going to fail, but that's okay along the way, and we just need to be, I think, more open to failure and experimentation. Thank you.